Hello everybody. Today is a fascinating topic for me because my goal and my mission in this channel is to create free dental treatments, which is no treatment. Now, we have interesting tips today that I'm going to give you. This technique has worked for me for years and years without me having to go every 3 months to the dentist or every 6 months. I go every year. I find I don't have any decay. I don't have any plaque, I don't have any calculus. So I will give you the recommendation. Dr. Jackie Chisikowski in Mexico City is a great periodontist. Told me one day about this technique called VAS Modified. And it goes like this. I'm not a periodontist, but as an endodontist, I always teach my patients together with my dental referral, my general dentist who's referred me the patient. We coordinate the way I'm gonna push our patients to create a habit to have a good technique for brushing and flossing. So together we do it, and I go and reinforce that. So we're gonna start, the key of that is to start thinking. Our mouth is divided by 4 quadrants. So remember, you have the right, the left, and then upper left, right, lower right, and lower left. Why I'm telling you this? Because it's so important that you understand that if you follow the quadrants and an order, and you go in a certain order, you will not forget anything about this technique. So you take your toothbrush. By the way, I have a whole show where we talk about what is the ideal toothbrush, and you're gonna see it there. It's soft and also it's easy to handle, and it's thin to the point that it's gonna fit all over between your cheek and your gums. Why I'm telling you this? Because when you have your mouth, if you start on the left quadrant, you're gonna put in 45-degree angles. Not like this, like a lot of people, you know how they do and brush like this? No. Just stay 45 angle degree, and then you're gonna go 9 times between the gum and the teeth, and then you're gonna brush 6 times like you're scooping out all the food. So you go 1, 2, 3, 4, 5, 6, 7, 8, 9, and then 6 times. Where the numbers come, I don't know. That's how I was recommended this technique, and I love it. But you can add 10 times and 6 or 10. It doesn't matter. The point is that minimum of 9 times 2 teeth, and then 6 times scooping out. And I teach my patients to do this movement because if you don't scoop out the food, this is a funny type of tone, I love it for teaching purpose. Then you go here and go exactly. Now, what happened when I tell my patients this technique? They said, okay, I will do it. Like many of us dental practitioners, we are assuming that the patient understands. And when I talk to my referring dentist, whether it's a general dentist or whether it's an orthodontist, a specialist, I always tell them, guess what? The patient said they understand, but when I ask them, show me what you understood in this lesson, they don't get it. So they have to practice, and I tell them in the second appointment, if they come for a root canal, second appointment, bring the toothbrush, and always ask them at the beginning to bring the toothbrush, whatever they're using to brush their teeth, because I will teach them, according to their general dentist, the correct dental brushing technique. So 9 times to teeth, you continue. If you do these movements, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 6, and at the beginning you're gonna say, oh my God, it's gonna take forever. I have a very famous producer friend of mine that we became friends, and she's funny. When she learned the technique, she goes, oh, you know, you guys want me to do like this, like that, and she puts the leg up. By the time I finish, my husband is gonna be sleeping and is not gonna wanna kiss me anymore, or whatever else he wants, he's gonna be sleeping. No, it's not true. You're gonna do it fast. At the beginning, it will take you 10-15 minutes, but at the end of the day, it's not gonna do it. And if you follow the technique I tell you, then you finish all over on the right side the same way, the lower right the same way, and then all the way when you go this way, you're having this 1, 2, 3, 4, 5, 6, 7, 8, 9, and you scoop it up. So if we wanted to see illustrated in this one, you continue the same way until you finish. And in the molars, you're gonna go this way, and you try to scoop out the food. Now, Once you finish this lower quadrant, you need to go to the lower, but this is hilarious. Look at this. You don't move the tongue of this typodont. You go, I don't know if the camera can take it, but this is going to the gums inside. Many people forget to go in this direction. So what you do, these areas that gets a lot of plaque, you keep going. Remember, 45 degrees, not 90, not 30, not 15, 45-degree angle, and then you go up. And the same here, you're gonna go like this all the way, then you push the tongue. This is funny, right? So I push the tongue this way. I love this type of tongue because for teaching my patients it's funny and they laugh. So this you finish all the way there. Now, when the patient is finished, you're gonna go, you did this quadrant, remember, all the way here, this quadrant all the way here, inside all the way here, and now you go from here all the way until you get here. Everything, remember, you go a 45-degree angle. Is the camera able to capture it? So this, and again, you go inside the gum until you get here. Why did I say the discipline of following the quadrants? Because so many people, how many people of you do like this way and then go down, and then all of a sudden you jump from here, you don't do anything, and you go here, or you forget this part inside. But if you follow this discipline, you will never have a problem. Then you go inside, and then the tongue, you're gonna take the tongue out and you're gonna brush your tongue this way, or you grab a tongue scraper and you scrape your tongue every single night. You get it out and you scrape your tongue to get all the bacteria out. After that, remember, I have a whole show talking what is the best toothpaste, and we come to the conclusion, yes, it's good to have fluoride on the toothpaste. It's good to have no alcohol on the toothpaste because alcohol will suction all, it dehydrate our tissues, delay healing. It's good to use chlorhexidine on the rinses, but no alcohol. And it's better rinsing with water. If you don't have money to buy an oral rinse, or you don't want to spend the money, just use water and rinse yourself. Water has a pH that is high, and it will help to remineralize our teeth. So this is another technique that I have. You can use any toothbrush. This happened to be Oral-B. They were very nice, took it to our office, and they know I love to do preventive teaching to my patients. Even I'm an endodontist. I think I'm one of the few crazy endodontists that is passionate about this. And this toothbrush is so important. So many patients says, oh, you know what? I use an electric toothbrush. Don't do hard. Anything of this technique, by the way, don't do any hard brushing. All of this is very soft. But when you do this part, it's really hard. This, you really put your strength in the upper and the up. And you're gonna see on the images here how we're gonna do it in an actual patient. It's fascinating because I help patients to change their life in the dental work treatment. Especially you're gonna see a patient, the one I have in here to present it to you, that has an overbite, and it's important that she take care of her teeth and analyze what is she gonna do with her bite later. Or if you have this type of bite that is a class 3, the kids can go from 4 years old to have orthodontic braces and treatment, and crowded dentition, etc., which is a part another show. Anyhow, when you're gonna use this is, I'm lazy really to be brushing my teeth sometimes, so if I don't want to, then I grab the brush. I don't do it very strong, and you grab it and you hear this noise and you go again, 6 seconds in each wall, 6 seconds, and also be sure this is going to between the gum and the teeth. You go 6 seconds in each tooth. Once this is, but it's not hard, remember. Once you finish, so all you have to do is place the brush, always moving. I'm not leaving it on because I don't want to have all this noise. You go all the way back, and then you go down, all the way down here. Remember, these are the teeth that have more exposure to salivary glands. Be sure you're going. Many people have crowded teeth dentition here, which is overlapping one to each other. It's very important. And you go tooth by tooth, everywhere on the walls of the teeth until you go to this wall, and then again, in this case, just for teaching purpose and moving the tongue, and you're gonna go in these walls, all these walls, 6 seconds on each tooth, which means 1, 2, 3, 4, 5, 6, and you change the tooth. These are so important. Salivary glands here have much impact on the accumulation of plaque, and many patients, for a reason, do not brush correctly in this area. So you go all the way to this area, and again, you continue in the discipline that we talk, quadrant by quadrant, until you get to this part, and you're gonna go 6 times every single wall of the tooth, including on the last part. Then you can brush the tongue, or again, you have your tongue scraper, no matter what company you have it, and you get the tongue out and scrape the teeth. And the walls, we call it occlusal walls or masticatory, how we masticate through the food. And we're gonna do this technique, is again, all the way upper teeth in the occlusal area. So now we talk about the brushing, and quickly we're gonna talk about the tooth floss. Flossing, what is the best dental floss, you know? And dental flossing has to be before your toothbrush. Why? Because you take the food out, you let it loose, and it's easier for the brush to get it out. Now, it doesn't matter what company you grab. For me, this is too small, but if it's enough for you, you grab on the upper area, and for that, I'm gonna use a type of them for kids. By the way, on the kids, you have to do the technique, and I advise people, you know, like in the United States, you use the middle fingers, and then you grab in a small space, and you're gonna go again from the back, and you scoop out like you brush it, like you are polishing the shoes, one side, the other, and down, one side, every single one. Like if you wanna go from here to here, here to here, and the point is you go to one side and the other, and you scoop it out. If you have problem, like you're trying to go here and it's not going inside, then you need to talk to your dentist that you're having problems. But if you have a fixed bridge and you're having a problem to go through this, there is a special device called dental threader. And it's like a needle like this, very strong, a plastic. You put your dental floss through here, and this is like a needle that is gonna go through this area, cross the other area, and then that way you're gonna have your floss and be able to floss. Again, from the left to the right, right to the left, inside, this, everything, but in the floss, it's just flossing like you're polishing your shoes. Then a patient told me he doesn't wanna use this no matter what I said. So I found this that many companies have, Crest, Oral-B, CVS, Pavilions, they have Select, you name it. And you can try with this one. Actually, I thought about it would be easier for the kids, but until they're 9 years old, you have to brush and you have to floss. So you go one side and the other side and pull one side. Again, remember, you start with the left, so the kid is gonna remember to follow a quadrant. And then you continue one side, the other. So don't go inside and out. A lot of people said, oh, I just go like this. No, if you do it, go like this, inside, and pull it out. So remember, these are very easy device. Some people use this as a toothpick. It's very soft. You can go over every tooth. And as long as you go in every single area of your mouth, everything is gonna be okay. I hope you like it. You're gonna see here, how do we do it at the dental office with the patient? How do we teach them until we have a good response? I hope to show you later the testimonials of patients, how his life changed. They don't need more root canals. But sometimes they do because they fracture the tooth. Remember, we have a topic about fractures. Thank you. I hope you enjoy it. Don't forget to subscribe to our YouTube channel and also follow us on Instagram. Press the button, follow us. And remember, my mission is to help to be dental free, which means no dental treatment. And I hope also you remember not only the brushing and flossing, but using the rinses with fluoride and no alcohol. Also avoid sugar. Sugar is acidic. Any soda is acidic. Coffee, tobacco, cigarettes, all of that is very acidic, but if you drink a lot of water, you're gonna help to remineralize your enamel by flossing, brushing, your rinsing with a good mouth washing, and following with water. Thank you so much. Follow us on Instagram, Dr. Fanny Yacaman, at your service, and YouTube. I hope to hear all your comments and questions. We will be able to offer any answer you want to know. Thank you.